I get asked all the time, how do I know if my pelvic floor is too tight or too weak? I just want you to know that's a complex question because floor muscles are layered up. So there's an outer layer and then there's a deep layer that holds all your organs. These different layers of muscles, they do different things. So the outer layers of the muscles, they do more things like closure. So they close, the urethral sphincter if I'm trying not to leak. They close the anal sphincter so that I don't have a leaky bowel or I don't pass gas and don't know it. Hi, if you're here right now, you most likely have a pelvic floor disorder and you're looking for help to figure out what you need to do in order to take care of this problem. That's why we developed Pelvic Floor Pro. Please take the quiz, and in the quiz, it will help you know which exercise plan is for you. These exercise plans have been developed specifically with your symptomology in mind. Follow the link below and get your free trial started today. Your pelvic health is important to us. So the outer layer's function is different than the inner layer's function. Also, the other thing to remember is that the pelvic floor muscles have two different types of muscles that are in the floor itself. And what I mean by that is they have slow twitch muscle fibers, and that means muscles that are on constant contraction all day long. So they're actually containing all of the organs in the right position. That's these deep bowl muscles here. Remember, the organs that they're going to contain for a woman are her bowel, bladder, and vaginal wall, uterus, cervix, etc. Those things become important to understand when you look at what might be going on in your floor. So your symptomology helps us determine what might be involved in the floor, whether the floor is too weak or too tight. However, there are so many people who actually have a combination of that. So they might have a leaky bladder. So it may be that the urethral sphincter doesn't have as quick a closure as it needs to, but it could be because there's some restrictions of surrounding muscles that are pulling at the urethral sphincter, so it can't be as efficient as it needs to be. And that is why pelvic floor healthcare is so important for people, is to understand, hey, what are those symptoms mean according to what the floor's job is and what it should actually be doing. So that's why it's important to have a really good history of, hey, I have a leaky bladder when I go to step out of my car. And immediately then we know, oh, did it happen any other time? Oh no, it only happens when I get out of my car. So then you go through the mechanics of, oh, what could be happening when I actually go to get out of my car? So I may be going to step out of my car and my leg that's moving is elongating. So as that leg moves to get out of the car to elongate, then it stretches muscles and their myofascial tissue that go into the floor. And then you think, oh, well, those muscles, if they're too taut, that are, related to that urethral sphincter, they might be pulling so that then the urethral sphincter can't maintain its tonal pattern once I elongate other muscles that are associated through the floor, through their myofascial tissue line. So that's why it's hard to answer that question, and that's why I always say, hey, we always want to look at symptomology patterns, history patterns. If someone was postpartum and had a tear in the perineal body of the floor, could it possibly be that some of the big wrapper muscles that go right around where the urethral sphincter were damaged or had scar tissue, and then that tissue became shorter and tighter? And this is why it's really great for you to have an orthopedic screen, because orthopedically we can look at movement patterns. So if I have somebody who has a stiff and a tight back, their lumbosacral area or the thoracolumbar spine, if that part of their back is stiff and tight, it can definitely affect the floor's ability to function. And most often, if I have a stiff and tight back, I may have a stiff and tight floor, so a floor that's not mobile. If I have somebody who doesn't have really good hip mobility, and it could be in multiple motions, it could be, you know, up and down into flexion and extension, it could be internal, external rotation, which definitely 100% affects floor's mobility. So if you have a hip that doesn't like to move, like you can put your sock on one side, no problem, and then you go to lift the other side and you can't put it on, you're like, hey, I don't have as good a rotation on that side of my hip. Most likely my floor on that side is too stiff and it's too tight as well. So the things that we always look at is we look at backs, we look at hip mobility, we look at how motion happens. Is it coordinated? Is it smooth? Is it stiff? Is it kind of grumpy, like when you go to sit to stand, almost like you can't get up easily? Those things signal to us that the floor might have more hypertension in it. So like it's more tense overall. And some people who have those things, they might not even have any symptoms in the floor yet, but that's a predictor for us that there might be long-term issues that might happen. So most of our patients have a combination of hypertension in some area or hypertensive tissue in some area of the floor, and then they might have weakness in other areas of the floor. And this is why it's so important for you to be screened with basic things, looking at your back, your hips, your pelvic motion patterns. And if they're not freely moving the way they should be, then we know that the floor might have too much tone present in that whole area. So it's great for you to be thinking through your history, maybe some of your symptoms, maybe some of the reasons why some of the floor muscles might be too tight or maybe too weak. Because think of it like this, you can have, you know, part of the floor be too weak, maybe the front of the floor, and then all of a sudden we'll have the rear of the floor that's too tight. So it's good to be screened. It's important to have a screening. Most of all of our screening starts in upright positions, and then we're mechanically going through, hey, what do the hip motions look like? What does the back motions look like? And how is the pelvis actually moving?